Well, in Top Topic, we take a look at one of the stories making headlines across the country. And today's topic deals with some of the effects of the healthcare reforms that have been going on all around the country. Now, a report from One China Times has said that all public hospitals in the southern city of Shenzhen and one in Beijing have begun scrapping their drug markups, which are leading the way in a comprehensive public hospital reform that is aimed at improving the quality of medical services and lower drug costs. Now, Ma Xiaowei, who is the Vice Minister of Health, said over the weekend that the hospitals in both cities undertook what is deemed the boldest and hardest part of the medical reforms, as a trial of the policy intended to take effect across the Chinese mainland. Now, Ma made these comments while inspecting the Beijing Friendship Hospital, which was one of the hospitals selected for the trial. Public hospitals on the mainland began back in the 1980s to make money selling medicine to support their daily operations after government funding cutbacks. According to Ma, doctors have tended to prescribe excessive or unnecessary medicines as a result of this practice, which has driven up medical costs and have strained doctor-patient relationships. Under the new initiative, the markup is removed and the economic losses incurred will be covered by increasing medical consultation and service fees. Now, a report from the Global Times has stated that Han Xiaofang, who is the head of the capital's medical reform office, saying that medicine sales generate costs instead of gaining profits for the hospital. She went on to say that doctors will prescribe medicines more rationally than before, and that will help optimize the use of the healthcare insurance fund and ease the heavy workload at large public hospitals and on their experts by raising the consultation fee. Now, the patients themselves have had mixed thoughts on the initiative. One patient from Shandong province who came to the Beijing hospital to treat a blood disease said that he didn't see his medical costs changing that much. He went on to say that I used to pay about 700 renminbi for the consultation and medicines. Now, the same medicine costs around 80 renminbi less, but consulting the veteran specialist I used to see cost 100 renminbi, which is about 80 renminbi more than before. Another patient who has only been identified as Ho said that she had a stroke and chose to see an ordinary doctor because the consultation fee for a specialist was still too expensive for her, and she wouldn't get health insurance reimbursement because she was not a Beijing resident. Many more patients have said that they would not consider consulting a top specialist because they would have to pay at least 20 renminbi out of pocket. Another patient in the hospital showed two of his receipts and said that his hepatitis prescriptions dropped from 322 to 280 renminbi. Now, the reports have gone on to say that medicine costs for Shenzhen public hospitals have also dropped, according to the city's Commission of Health, Population, and Family Planning. So it appears as though we're starting to see some of the effects of these reforms that were made to the healthcare system. And hopefully the relevant authorities will be able to iron out the kinks in order to make sure that everyone will be able to benefit as much as possible, both the patients and the hospitals. Well, next up on Media Watch, we take a look at the name in the news.